You said my hair looks good. It looks bad. Hi, welcome to Sleep Time. Really? We're here again tonight to talk about sleep disorders, share some experiences with you. Um, there I go again. Give you some information about sleep disorders. Dr. Levine is here again with us tonight. How are you doing?
Great.
Did you have a good day? I didn't
Yes.
ask you that.
Had a great day.
You had a great day? I had a good day too. I had to take care of some business with the bank, and it really turned out well.
Oh, that's good.
Isn't that a good thing? That's a good thing. I know that has nothing to do with what we're supposed to be talking about. Okay, so we're going to talk. We're going to start again tonight. Last time, Dr. Levine talked about and went over sleep apnea
Yes.
and insomnia
Yes.
and narcolepsy.
Correct.
The signs and symptoms and the actual specifics to each disorder. So you want to go through and kind of review that,
Sure.
and then we can move on from there and see
Okay.
where our callers take us.
Absolutely. We can start off with the most common, I guess, and also most dangerous of the three being sleep apnea, a sleep disorder that causes patients to stop breathing in their sleep, um, which can be very dangerous as it relates to organs in the body such as the heart, lungs, and brain, because if you stop breathing, of course, your oxygen level will fall, and when your oxygen level drops in your sleep, that could lead to premature heart attacks, strokes, and even death in sleep. So sleep apnea is a serious, potentially fatal sleep disorder that signs are snoring and excessive daytime sleepiness or fatigue. Those are the most common signs and symptoms, but there are also other symptoms like memory loss, irritability, um, and even weight gain, worsening high blood pressure, worsening diabetes. So there's several signs and symptoms that lead one to think that they may have this sleep disorder.
That's
So
interesting.
the correct action to take is to either inform your physician, your primary care physician,
Hmm.
that you think you may have this sleep disorder based on the signs and symptoms that you're experiencing,
Hmm.
or you can self-refer yourself to a sleep center to present your information of signs and symptoms directly to a sleep physician, and then he'll more than likely run an overnight sleep study to determine once and for all if you have indeed sleep apnea.
Now that's a good point, because I was wondering if you could directly refer yourself, because a lot of
Yes.
times you have to be referred,
Yes, you can self-refer.
even with Medicare, Medicaid.
Yes.
Okay.
Medicare, Medicaid might be an issue, but private health insurance for sure. But Medicare and Medicaid, you may have to get your primary care physician to refer you. But again,
Okay.
that shouldn't be a big deal, because once you inform your physician of your signs and symptoms, it's a pretty easy thing to do to refer to a sleep center for
Okay.
further testing. It's the only way you'll find out if you have it. And
Now snoring can be a part of it, but not necessarily.
that's correct.
Or you can snore and not have sleep apnea.
That is correct.
Okay.
They're both
So
correct.
just because you snore doesn't mean you definitely have sleep apnea.
Correct.
So don't go getting scared if you snore and think, oh, I got sleep apnea, because that's not necessary. You have to have the other symptoms to go along with it.
Correct.
Okay. Another question I want to ask you about is those, I've seen them a lot on TV in the last probably year or so. Those devices that go on the nose or in the nose
Yes.
that they say stop sleep apnea.
Correct.
Aren't those things dangerous?
Well, they're only dangerous because they really don't adequately treat the disease of sleep apnea. So the proper way to treat sleep apnea is, first and foremost, the best way, in my opinion, is to get on a machine called a CPAP machine or a BiPAP machine. It's called PAP therapy, and it blows positive pressurized air through a tube that's connected to a machine, that's connected to a face mask, that keeps your airway open all night and keeps it from collapsing and closing on itself and stopping you from breathing.
And
So
that thing they stick in your nose doesn't keep that airway from collapsing.
No, it doesn't. Those devices may work somewhat if somebody has a condition called primary snoring without sleep apnea.
Okay.
But with sleep apnea, the PAP therapy is definitely the treatment of choice, so to speak. Surgery can be performed for sleep apnea, and there's another treatment called an oral appliance that's usually prescribed through dentists.
Okay.
But the PAP therapy is by far the best treatment, in my opinion, of sleep apnea.
Right. So the point here that I'm trying to get across is those devices, if you have sleep apnea, doesn't treat sleep apnea.
That's correct.
And so the symptoms of the sleep apnea with the airway collapsing and cutting off the airway is not stopped.
That's right.
And so it can actually be dangerous if you get one of those and believe it's going to work, but it doesn't. You know, that's a perfect setup for
this.
dying in your sleep.
Yes, unfortunately, it is. And, also, I failed to mention that, if someone is overweight or obese, weight loss also is part of the treatment regimen for treating sleep apnea as well.
That
And,
is so cool.
yeah.
That is so cool. Call in, ask us questions, make comments. Again, I said before, you can tell me my hair's messy. That's fine with me. Call in, make the phone ring. Make the phone ring. Come on. So sleep apnea is pretty serious.
It's very serious.
Medical condition.
Yes.
Medical condition.
Yes, it's also connected to some other serious illnesses that the public might be more familiar with or aware of, such as heart disease like coronary artery disease or heart blockage, which can lead to heart attacks, stroke, or TIAs even, transient ischemic attacks, which are like baby strokes, are associated with sleep apnea.
Wow.
Even dementia, like an Alzheimer's disease like dementia, is now recently been connected with long-term untreated sleep apnea.
Wow.
So even arrhythmias, irregular heart rhythms like atrial fibrillation is connected directly with sleep apnea.
Wow.
So there's many, many serious medical problems or diseases that's directly connected to sleep apnea, as far as it promoting the disease or for sure at least worsening the disease.
Wow. And these conditions, when the sleep apnea is treated, the conditions themselves get better.
They get a lot better. Even hypertension, diabetes are two other illnesses. And obesity, when sleep apnea is diagnosed in that individual and the treatment is ensued, then these conditions such as uncontrolled hypertension or uncontrolled diabetes, arrhythmias, heart disease, stroke phenomena, they all improve. Obesity even improves with the treatment of sleep apnea.
Okay, now you're saying specifically sleep apnea.
Yes.
But I want it to be said that that's true of other sleep disorders too.
Absolutely, because sleep deprivation in and of itself, which is obviously caused by any sleep disorder, could be detrimental to an individual's health as it relates to these other conditions as well.
Right. Well, I know since I've started treatment under you for the narcolepsy, my blood sugar levels averaged in the upper 400s. Averaged. Even taking my insulin.
Yes.
Averaged in the upper 400s. In the past week, one time it was 81,
Wow.
and one time it was like 73.
Wow. And how long have you been on a phone call?
We got a call. Hello? Cherie here. Who's this?
Hello?
Who's this?
This is Laura.
Hey, how you doing? You,
I'm all right.
you got a question or a thought?
Well, yeah, actually, how common are sleep disorders?
Well, sleep disorders it depends on the kind, but take for instance sleep apnea. Sleep apnea is probably about 1 in 4 to 5 individuals in America has sleep apnea, and that's the prevalence on that particular sleep disorder. Insomnia, it's about 10 to 12% of the general population. Narcolepsy, it's reported at 2.5 to 3%, but I believe it's probably more along the lines of 5% of people in America or just worldwide in general have narcolepsy. So those are just some numbers thrown out there of 3 of the most common sleep disorders
What
as far as
about the
prevalence.
periodic limb movement? Not
Periodic
the
limb-
restless leg.
Oh,
the
restless
RL.
legs, restless leg syndrome, probably between 5 and 10%.
Yeah. Do you have any symptoms of a sleep disorder?
Well, other than not being able to sleep sometimes,
Yeah.
that's my biggest problem is getting to sleep sometimes. Usually once I'm asleep, I'm fine.
Yeah. But you have a hard time getting there.
Yeah, a good night, it takes me an hour to get to sleep.
Okay, well, sometimes when people have problems getting to sleep, a lot of it has to do with sleep hygiene. So you might want to make sure your bedroom environment is appropriate for sleep. Like the lighting has to be dark. No TV or computer or any type of bright light should be in the room. The room temperature needs to be comfortable. Noise factor needs to be very quiet. So sleep hygiene is very important. Also, timing of sleep. You want to try to make your bedtime always the same or close to the same time every night, as well as your wake time should be pretty much the same time every morning.
Do you do all that?
Hmm?
Do you do all that?
Yeah, my bedtime is usually about the same every night. Getting up is a different story.
Yeah, and
I don't always
sometimes,
get up at the same time.
Do you wake up during the night, or once you're asleep, you stay asleep?
For the most part, once I'm asleep, I stay that way. Sometimes I have to get up to go to the bathroom. But
Yeah. So for you,
I
it's
usually
just
don't have a
getting
hard
to
time
sleep.
getting to sleep after that.
Is your mattress comfortable? Is your pillows comfortable?
Yeah.
Yeah?
now when you're in the bed, if you're having a hard time, like you said, it takes you an hour to fall asleep, the worst thing you can do is stay in the bed and struggle like that. I would rather you get up out of the bedroom, go like in the living room, read a book, something that's not too stimulating, like a novel or something like that, under like a lamp, until you get sleepy again. And once you feel yourself drowsy and getting sleepy, then you get up and go back into the bedroom, get back into the bed, and 9 out of 10 times you'll fall asleep in no time.
Okay.
Yes.
You don't do that, huh?
No, usually I'll try to read in bed.
No, yeah, a lot of people make that mistake. But the best thing to do, because it brings on more anxiety, if you're still in the bed. So get out of the bed, go in the den, start reading a book, and then when you feel yourself getting sleepy again, return to the bed, and usually you'll fall fast asleep.
Well, it's also trained your body, when you read in bed, your body is being trained to do that. You do
Activity.
other things besides sleep.
That's right.
Okay.
So if the only thing you do is sleep in your bed,
That's right.
then your body will be more prone to relax and respond to going to sleep.
That's
But it
right.
has to be trained, and if you've already trained it that you're gonna read, then it has to be retrained.
Okay. Okay.
Thanks for calling.
Yeah, that's helpful information.
All
Yeah,
right, well, thanks for
thank
calling.
you. Talk to you later.
Bye.
Bye,
Bye-bye.
babe. Hey,
a
that
good
was pretty
question.
cool.
That was a good question. That's what she brought up is a very common, in society, in our society. We have a hustle and bustle society. So getting to sleep sometimes can be difficult. And
Mhm.
so always preach sleep hygiene first and foremost before even thinking about prescribing a sleeping pill.
Right. Right, especially if it may be just insomnia.
Exactly. If I think that it's just insomnia we're dealing with and nothing like sleep apnea or narcolepsy or anything like that, then right, I will try to correct sleep hygiene problems
Right.
first, and then if that doesn't work, then you move your treatment step up a notch.
Well, in order for her to read, that means turning a light on,
Exactly.
which also
It's
changes.
a poor principle in the bedroom. That's right.
Yeah, which is
Changes the
going-
environment.
Yeah.
Yes.
So, yeah.
It defeats the purpose.
So that makes sense. I mean,
Yes.
that's really neat. She's right. That's good information. That's pretty cool. Anybody else? Somebody else call in. Ask a good question. That was a good question. So, somebody else call in.
And
Make
not
us
a-
think.
and not a chief.
Test us to see if we know what we're talking about. So far we've been talking about the sleep apnea
Yes.
and the symptoms of it and how that device in the nose doesn't work for sleep apnea.
Those breathe right.
The breathe right things.
Thing you're talking about. Yes.
Mm-hmm. And my mind just went that away.
Well, now
So-
since she brought up insomnia, I guess we can continue to touch on that.
Okay.
She was talking about, by the way, sleep onset insomnia,
Mhm.
and then you also have sleep maintenance insomnia, which you ask her about because you ask her, do you wake up in the middle of the night a lot?
Mhm.
If she had said yes, then I would have diagnosed her as having sleep onset as well as sleep maintenance insomnia.
Okay.
But she said no, so her diagnosis would be sleep onset insomnia. Now, I didn't ask her the time frame. How long has it been going on? 1 month, 6 months, a year? Because that question
Oh, with
is
her,
relevant.
that's been going on for years.
If it's been
That-
going
that's-
on for years.
I know the caller, all right, I will admit, I know the caller.
Then-
It's been going on for years.
Then she has what's called a chronic sleep onset
Yeah.
insomnia. But even though it's chronic, because it's sleep onset in particular, she can still potentially cure the problem based on sleep hygiene principles that she needs to adopt to.
So just behavior,
Yes,
just behavior.
yes.
I
Simple
mean,
as
that's good news.
Yes.
That is good news, that if you have insomnia, that there are techniques and behaviors that you can adjust and change
Mhm.
that can take care of the problem without being put on medication
That's right.
and without running the risk of having side effects from medication and all that kind of stuff.
That's correct.
Another caller. Hello,
Hey, Carlton, who's this?
this is Cherie. Who's this?
Mike Sonier.
Hey, Mike Sonier, what you doing?
I was diagnosed with sleep apnea when I had Dr. Martinez, age 20.
Age 20?
With Dr. Martinez.
Yeah, I know him.
Okay,
I remember
okay.
him.
Yeah, he knows what I'm talking about.
Uh-huh,
I seen Dr. Steuben and took a renewable test. The decreased the pressure 13.
uh-huh.
16 was too much leakage.
Repeat it?
The decreased the pressure 13.
Okay,
At first to 16, there was too much leakage.
correct.
The air was leaking out.
Yes. Yeah, that's a common practice if you have a lot of excessive air leakage from the mask, then sometimes a sleep physician will decrease the pressure in the CPAP machine to reduce that air leakage out of the mask.
Yeah.
Yeah.
You have claustrophobic, you put on nasal pillows.
Yes. Yeah, well,
I claustrophobic.
Well, yeah, and that was another reason they try to reduce pressure is if the patient can't tolerate the full face mask, and because they're claustrophobic like yourself, then they'll switch them to the nasal mask, like a nasal pillar mask, which is less cumbersome on the face, but the pressure being lowered allows you to be able to tolerate and use a nasal mask. So that's true.
Is it helpful to you, Mike?
Yeah.
How long you been on the treatment?
Well, the 15th September, a couple of weeks, 30 years approximately.
Wow.
Wow, yeah.
Yeah.
Dr. Martinez from the beginning, he passed away.
Yeah, I know. Well, that's great. I mean, it's good to hear a patient, like yourself, being compliant and consistent with the treatment all those years. And because of your consistency with the treatment, you've avoided a lot of medical problems that otherwise would have happened.
Yep.
Yeah,
That is so neat.
yeah. So that's
That's-
encouraging to our audience to see that, if Mike can do it and wear and utilize this treatment for this many years, then anyone.
Snoring a lot and difficulty breathing and drinking water every 2 minutes.
That's
Mhm.
right.
I have it too.
That's right.
Yeah.
Because before I got diagnosed with it, I was drinking water every 2 minutes and I was having a hard time breathing.
That's
Yeah.
right.
My throat was getting completely dry.
Yeah, that's because your mouth was always open because you had what's called air hunger. Because when the airway is closing off, you're hungry for air, so you tend to breathe with your mouth open, trying to get more air in your lungs, and it dries out your throat and your
Water
mouth.
that your throat.
That's
Yeah.
right. And then you drink a lot of water throughout the night to try to deal with the dryness in your mouth and throat. But then you're also urinating all night because you're drinking water constantly.
Yeah.
Yeah, it's not easy to live with sleep apnea when it's not treated.
Do you get your hoses and everything changed regularly?
Yeah, with health management.
Yeah,
Good,
yeah.
good for you.
Wonderful.
Well, I'm glad you stuck with it all these years and just, continue to stick with it. Let me tell you, it's worth it because I've seen the other side. I've seen the bad side of untreated sleep apnea, and it's ugly. It's brutal.
30
You need to
years.
sleep more during the daytime. Have a hard time sleeping at night, then they fall asleep at work more.
Right,
That's right.
right.
Yeah, it
Mess
affects.
up and oxygen in the brain
That's right.
depleted.
That's right, and that's
Right.
what I was alluding to earlier by saying that they've connected untreated sleep apnea now to the earlier development of dementia.
Yes.
Yeah,
What?
Also,
Go ahead, Mike.
also mess up concentration as well.
yeah, which could affect your ability to do your job at your work at your job. It can cost you your job, or you making a lot of mistakes on your job. So you're right; it affects your memory, your cognition, your thinking ability, and all that.
Can we throw that question up on the board? The one about general sleep deprivation can cause decrease in, yeah. I had put these up earlier, true or false, general sleep deprivation can decrease concentration and clear thought processes, leading to confusion and anxiety. And you now know the answer to that is true. That just general sleep deprivation, no matter what it's caused from, no matter whether it's caused from a sleep disorder or just
depression.
whatever, or depression or whatever, it can cause confusion.
That's right.
And it can decrease your ability to think clearly,
That's
which leads to confusion and anxiety.
That's
Because you're very much aware that you're not thinking right.
That's right.
And it
also
can
it
cause,
messes up when you're driving too.
That's
Yes.
right.
Yeah,
Yes.
we try to treat it. But for me, I don't drive because I have a history of epilepsy, so I don't drive at all.
Okay. But you're correct. Car accidents, a lot of the times is caused by untreated sleep disorders.
oh, we have 20 seconds. Thanks
Okay.
for calling, Mike.
Thank you.
Call
All right,
again
Mike.
call again next time. Oh, we need to throw the credit up. Throw our credit up. The show's almost over. We've got 8 seconds.